4 years ago, my psychiatrist told me, I advise you to finish working. It's too tiring and too stressful for your body. I told her that working is good for me. I have a bed with a computer screen above it, linked with a laptop with voice recognition, so I can lie down vertically when I am tired and work at the same time. She replied, if you need to lie vertically to work, you do not work. You will be burned out in 5 years. My orthopedic surgeon had a totally different opinion. I just completed within his department my master thesis in medical sociology on the theme quality of life in patients with osteogenesis imperfecta, the rare disease connective tissue disorder that I have myself, also called the brittle bone disease, or OI for short. The orthopedic surgeon was really happy with my contribution, knowledge and patient expertise during the traineeship. He said, you perform in 12 hours what somebody else does in 24. He saw my spirit. If you don't work, he said, you are crazy. I could totally agree. The same month I started social consultancy, an enterprise in people-centered advice, training, product management in healthcare. Of course, my body is often tired. I have many assignments and travel throughout the whole country. I do not lie flat as often as I intended. I often have a backache, some metal in my spine broke down, and of course, this pain causes fatigue. Nevertheless, work gives me a lot of energy. Inside, I fizzle. I'd rather take some morphine and go to work than be at home and not work. I have the more severe type of OI. I've had more than 65 fractures in my vertebra, arms, hip, neck, ribs, to name some few. I also have a severe scoliosis, which not only causes a lot of pain, but also ensures that I have less air. My muscles are quite weak, so moving costs a lot of energy. A particular outcome of my master thesis was that people with the severe type of OI felt more vital than those with the less severe type. I talked with a lot of people with OI about fatigue. They told me they would love to get insights in patterns of activity, pain, heart rate, and self-reported quality of life. In 2014, I continued to examine the subject in the ISLA clinics. I've read many scientific papers on fatigue and had contact with several university centers, researchers in this field, and innovation companies. I discovered that a lot is unclear about fatigue, not only in connective tissue diseases, but also in other chronic diseases. The scientists told me that they would love it when we let people collect data themselves. These patients will not only get insight in their own patterns of fatigue, pain, heart rate, mood, and other variables I hope we will discuss this weekend, but they also could choose to share this with their doctor or even with researchers. Maybe with long-term data, specific correlations between variables in specific patient groups could be known. These insights could help to design and advise interventions to reduce the fatigue and improve patients' quality of life. Wouldn't that be great? One of the very interesting questions is how to track activity when somebody is in a wheelchair. I'm so curious to discover, together with you and the fantastic available instruments, what is possible. Some people say I look like B.A. Baracus because I have a big, tough wheelchair bus. So, I agree today because I'm looking for an A-team. If you think you can help out, please apply. I look for a designer, a researcher, developer, statistician, quantified self-specialist, and all the people thinking right now I'm the one for her team. And I need a really good project manager because it's not healthy for my body to be here 24/7. I do really work hard, but I'm not crazy. And by the way, it was almost 5 years ago. My psychiatrist told me you will be burned out in 5 years. And as you can see, I'm alive and kicking.